So tell me what the situation is with vaccines coming to Hilo Medical Center.
That is a really broad question. And no, we do expect to get vaccine shipment here in the next few days, likely Sunday or Monday. We will most likely be getting the Pfizer vaccine because it requires the most special handling. So from what I hear, it's been reserved for hospitals. We're hoping for an allocation that covers all our needs, but a lot of that's being determined by how much the state gets, and then in turn how much is distributed to the various hospitals. We know the Pfizer vaccine is shipped in these containers of 925 doses. So we're hopeful we get at least one of those. We may get more, but again, we're not sure.
So the most you could get is 925 vaccines at one time?
The way Pfizer has it set up is they don't split the amount. So you would get 925, or you would get 1850, meaning 2 packs. But because of the special cold storage that's required, they don't do smaller increments.
Okay.
So we would get it in multiples of 925. So it's hard to tell. We also are still working out potentially being a distribution source for other facilities, but that part hasn't been completely worked out since we have one of the special freezers that keeps the vaccine very, very cold.
Are you the only medical center here on the Big Island that has that special freezer, or are there? You are, okay.
Yeah. Mm-hmm.
So you would be a distributor for all the other hospitals on the island, is that right?
Well, we could be. I think West Hawai, the Kona Community Hospital, are working through their process. You can get this storage pack from Pfizer and get, as long as you use all of the contents or all the vaccines within 14 days, then you don't need a special freezer. But if you want to keep it any longer than that, you would need the ultra cold freezer. I can't speak for them, but so it is possible for a hospital to get, the 925, have it all arranged where they can vaccinate the people who are qualify and are interested, and not waste any.
So what's been the interest among the staff at HMC as far as receiving the vaccine, and will they be required to take it if when it comes in, if they want to continue doing shifts and covering shifts on the floors and things like that?
Yeah, so we're not requiring our employees to take the vaccine. That generally falls under employee mandated whatever, right? So we're not doing that. Even though most employers can require some things, one of the things they cannot is like an experimental medication. And in some ways, because it's an emergency use authorized medication or vaccine, we can't require that of employees as a condition of employment. So, but there are other things that eventually it may become something that is required, but right now it's not. And we think people should decide on their own if they want to be vaccinated or not.
Do you have a distribution plan as far as, when it does come in Sunday or Monday, is the hospital going to vaccinate all those who are the frontline workers, like the nurses and the doctors, and then where would it go next? Would it go to the patients who are at risk? Would it just stay all in-house at the hospital, or would you do drives to the public?
So that's a lot of questions contained in there.
Sorry.
No, that's fine. But to kind of give you an overview, starting really big, the CDC, Centers for Disease Control, they actually have a committee that's prioritize who gets the vaccine. So long-term care residents and the employees of those facilities and frontline healthcare workers are in the first priority group. And then there's a second priority group and a third. The second is, I think there's going back and forth around that about those with pre-existing conditions or essential workers, and that really hasn't been decided completely yet. And then the third group is the general public. So right now we're just really worried about priority group 1. And so for us, that would be all those individuals in the hospital that have significant exposure risk to COVID, to contracting COVID. So that would be your nurses and aides and the staff who support them, caring for potential patients who might have the virus, or they could get it in the normal course of their duties. And then we also, in that grouping, include hospital workers in general. It's a little bit larger in the group, but we will start with the most at risk and then work our way out, because we're not sure how many vaccines we're going to get, and we also are not sure of how many people want the vaccine. So there's we have plans really for all those contingencies. You asked when we would start vaccinating, so and if we had a plan, we do. Likely, if we get vaccines on Sunday or Monday, we would start our vaccine clinic within 48 hours. It actually requires a good deal. It's not that easy to administer. You have to follow certain very rigorous steps when you get the vaccine ready to administer. So we will have a clinic, we'll have healthcare providers who know what to do. We have our pharmacists involved, and we'll actually do it by appointment so we don't waste any. And then also so we can answer anyone's questions and whatnot. So we have quite an extensive plan. Likely we'll be vaccinating over the course of several days.
You mentioned that there's I guess, there's steps that are taken to administer the vaccine. What are those steps?
Well, like a vial has 5 doses in it, and it has to be diluted, and then it has to be done, the diluent needs to be mixed in a very specific way, so each dose is the same. So like in our setting, the pharmacist will actually do the mixing and prepare the syringes, so the nurse or the LPN or whoever is administering the shot has basically a pre-prepared vaccine syringe. So that process is not quite as simple as some vaccines, which is just like you get a single dose vial, you just pull it up and you administer. So it's a little more involved. And then there's also the government is asking that records are kept, so you keep track of who got the dose, and then they have to get a dose in the case of the Pfizer vaccine 3 weeks later. So, it's not like just going to Walgreens and going, hey, can I have my flu shot? And they go, and you're done, right? It's a little more involved than that. Yeah.
All right. And I don't know, this may seem like a silly question, but I'm not a doctor. Is there any specific, can you just give it in the arm? Is that?
Yes.
Okay.
It's not a silly question at all. It's what they call an intramuscular injection. So you give it in the kind of the more meaty part of your arm. Depending on your weight, the needle is usually either an inch or inch and a half, just to make sure it gets in the muscle. Most people have very mild side effects. More so with the second dose than the first, as the body starts responding to the vaccine. You'll get, some people feel fatigued, they may run a short-term low fever, but in most cases, they're very mild symptoms. People get sore arm. It's like if I get the sore arm every year when I get the flu shot, but it's been pretty well tolerated. It's not pretty well, it's been very well tolerated in the stage 3 trials where they had over 30,000 people participate. So.
And have you done any straw polls as far as how many of the staff at HMC would be open and willing to take it once it arrives?
We did we did a little more than straws. We did Survey Monkey, so we used that. But we actually sent it out to all our employees, and we had about 650 of them respond. Roughly 44% said that they would not. Excuse me, they would take the vaccine. 28% said they were undecided and would think about it, and another 28%. 27 and a half or whatnot said no.
How many employees does HMC have?
Well, employees, contractors, and physicians, around 1,500. So if you lump them all together. So we got about half the folks respond, which is, is actually way more statistically than we needed. So I think the results are pretty valid. What I've heard anecdotally is that this is consistent with other polls in Hawaii. They're running somewhere around 40-50% of people would take the vaccine.
That's encouraging.
It is, and I think realistically, you have about half that would, and then you're going to have the other third that normally would take vaccines. They just go, I just don't want to be first. I want to make sure nobody has any real problems. Did you tolerate it? So I think that number will go up by the time we get into the spring. I'm not sure. I think everyone has understandable reservations about anything that's new and anything that was so politicized, like this whole vaccine process. I mean, I'm going to take it, but I did my homework, and it wasn't just like getting the flu vaccine. I was more thoughtful, so I can understand why people, would go, well, I'll wait and see, and even why maybe a few people would say no, even though I wouldn't advise it.
Right. And is it only one shot and you're vaccinated, or are there a series of shots that you have to take?
Well, the Pfizer vaccine, which again is going mostly to this first group, is a 2-shot process. So you get one, and then 3 weeks later you get another. The next vaccine that's coming out, likely probably people would get it toward the end of December, is the Moderna vaccine. And it's also a 2-shot vaccine, but you get that one 28 days, the second shot 28 days after the first.
Okay. So pretty similar.
And I think the next one in the queue is probably the AstraZeneca one, which is probably looking at March. That's, I think what I've heard, it's a one dose vaccine.
Oh, okay. All right. All right. Well, that was a lot of information to go over, and I'm sorry I just threw stuff at you, but it was just, it's all very interesting. So.
It is interesting, and you're asking the same questions that any intelligent person would ask. So, so don't feel at all like you were like, why am I asking this? No, we would all ask those questions. Yeah.
Yeah. Well, I just, I think people, like, I don't know. I always think that, when you assume that when you get a shot, you're going to get it in your arm, but you never know. So.
No, there's some, we give shots a lot, and some of them can't be in the arm if being a deeper muscle, or some of them are just right under your skin. So, no.
Right. Well, is there anything else that you would like to add just about the vaccine, it coming to the Big Island, and the rollout?
I would just recommend, to people to do their homework and keep an open mind. But I think to also understand that a vaccine is probably it's the safest and the quickest way to get us back to a more normal life. And, we all have kind of a collective responsibility to do what's good for our communities and, to protect our loved ones. So I think this is a good idea, so I would endorse it.
All right. Thank you very much. I really appreciate it.
Sure. Nice to meet you, Tiffany. Take care.
Nice to meet you too.